For this occupational therapy portfolio topic, I'm going to be assessing my patient's wound and doing a skin inspection. So my patient here has a wound on their upper forearm of their right arm. So I'm just going to go ahead, show the camera your wound. Okay, so I've noted the location, and now I'm just kind of with my eyes looking at the wound, I'm not noting any moisture around it or any dryness or thinning of the skin. It does feel maybe a little bit red, or it does feel maybe a little bit warm to the touch around the wound, and it's red and looking a bit swollen. Some other colors you may note with wounds is white, which could mean decreased blood flow, blue, which also could be decreased blood flow or a lack of oxygenated blood to that area, or purple, which can mean bleeding or bruising in that area. So what I want to go ahead and do is measure the wound. So I'm going to measure in centimeters, and it's important that every time you measure, you're measuring in the same measurement. So choose centimeters or inches and make sure to measure that in that always, and to make sure to note that in your documentation which one you used. So first I'm going to do one from the top of the wound near the head to the bottom in the direction of the feet. So we've got 6 centimeters, okay? And then I'm going to do one perpendicular to that across the wound. So we have 5 centimeters there. And because I'm noting some redness and inflammation, I'm going to go ahead and measure around the wound. So I'm going to make sure to pull out enough to make sure I'm not pulling on the wound too much. And what I'm going to do is measure around it at its thickest point, or its most inflamed part. Okay, so this is 15 and a half centimeters. Okay, and when you're measuring a wound that is more proximal to a distal part of the body, they could be experiencing some of that inflammation moving down the extremity. So I've noted inflammation here. If I believed that there were inflammation further down into the arm, I would measure in segments. And another thing that I would want to know is whether or not swelling is getting into the hand. So I'm now going to use a figure 8 pattern to measure the swelling or the inflammation in my patient's hand using a figure 8 pattern. So again, I'm going to measure in centimeters, and I'm going to go ahead and start at the ulnar styloid, come across the dorsum of the hand, and back down to the starting point, and I got 38 centimeters. And anytime you're doing a measurement, especially for inflammation, you want to make sure to measure on both sides, as this wasn't necessarily my patient before the wound, so I don't really have a baseline measure of what the forearm's supposed to be, so sometimes you may not be able to see that there's inflammation. So a good way to get a baseline and to know that there's inflammation is by measuring their unaffected arm as well. With this wound, I can go ahead and press around it, and I'm not noting any pitting edema as the skin is bouncing back right away, and I'm not really able to press any deeper than I should be able to normally. And another measurement to get when assessing a wound is on this patient, this wound seems to be very superficial, but on some people, their wound may go deeper, and what I can do to measure that would be to use some sort of a sterile object, such as a Q-tip, that I can place down into the wound to measure the depth of the wound. And while we're doing a skin inspection, another test that I may want to do is the Skin Tuger test, which tests for skin elasticity and hydration. So my patient is young, so what I can go ahead and do is do it on the back of her hand, and what I'm gonna do is just pinch the skin and watch to see how long it takes to rebound. It didn't take any time at all. It rebounded immediately, which tells me that the elasticity of that skin there is good and that she's hydrated. If my patient were older, I could do this in 3 different locations. I could do it at the sternum, the collarbone, or the forehead. And one more thing to note when you are measuring, again, you want to measure using the same measuring units each time, but it's also helpful to measure at the same time every day and the same location as well.